So what are the type of stations you'll come across during the MMI or panel interviews? Well, there's plenty of different types of questions you'll come across, and we will cover all the different types during this course. All right, just to list a few. All right, one of the questions you tend to come across are the very traditional ones. All right, these are questions that I came across when I went to medical school. These are your so-called evergreen questions that will always come up in one way or another. All right, so for example, in assessing your level of knowledge, especially with the Oxbridge interviews, to look at your knowledge level of something, these types of questions you should prepare for. And that's why I say you should prepare for interviews, because you can learn some things which will come in handy during the interview. You get questions that look at your understanding of medicine or dentistry. You get questions that look at your understanding of key medical issues. You get questions that look at your motivational levels. What is it that brings you to medicine? What is it that brings you to dentistry? These questions will never go away, and we teach our students really well in these topics, so that you can navigate these really well come the interview. Increasingly, of late, we are seeing more scenario-based questions. Now, these are the kind of questions that myself and Imran didn't come across as much many years ago. But nowadays, because they want to see application of knowledge, they give more scenarios. So you'll come across scenario-based questions. So this and that is happening. What do you think? How would you respond? That kind of questioning is happening more and more these days. Practical tasks. Although during the pandemic you won't see as many practical tasks, after the pandemic I'm sure you will see plenty of them. They were there before, they will be there in the future. So testing of like manual dexterity, calculations, interpretation of data, doing things, following instructions, giving instructions, anything really that can test you in a practical way is fair game. They will bring practical tasks up, and you should be able to navigate those well. We will cover quite a few of those stations during this course. We also see that the scenario-based questions are sometimes played as role plays. So what do I mean by that? Well, for example, there's a patient here. The patient is angry. They'd like to talk to their doctor about something. So could you please have a look at this scenario and do it as a role play? Well, these are the kind of questions that come up every now and again. So you need to be comfortable doing role plays. You need to be comfortable doing consultations. You need to be comfortable talking to people, managing that situation at the time, whether it's an angry person, whether it's a calm person, a person with normal mood, or a person with abnormal mood, or mood such as depression, anxiety, suicidal, or whatever. You need to be able to manage that kind of a scenario. We also see that there are questions in regards to public health. What are the wider determinants of health in society? So like the vaccine, for example, COVID-19, for example, these are classics that will probably come up time in and time out over the next few years. What impact does that have on society, on individuals, on institutions, on governments, and so forth? These things are always there. If you're watching this course from Australia, for example, questions regarding indigenous population comes up all the time. If you're watching this course from Canada, you actually find that the First Nation issues come up with regards to questions in the MMI. So bear that in mind. So what are the nuances of communities that you live in? Have a think about it, because they might show up as well. Lots and lots of questions come up where you watch a video, and that could be a video of consultation which you then have to critique. That might be a video of something happening, some scenario, and then you have to kind of answer a few questions around that scenario. So videos is something that isn't unusual nowadays. The ethics, situational judgment, behaviors, morals, manners, don't forget about them. Extremely important. You must learn these key principles and be able to navigate them really well. They come up very often, very frequently. I've already mentioned data interpretation, haven't I? But I guess it makes sense to mention data interpretation in its own way, in its own right. And that's because they're very common. It's important to be able to handle data as a doctor, as a dentist, because it will be part and parcel of being a doctor or a dentist throughout your lives. And so they come up quite a lot. People ask me as well, will I get questions around my personal statement? The answer to that question would be, you must assume you will. Some universities do. Some refer to your personal statement. Most don't. Most will look at generic qualities that you have talked about in your personal statement. So that's something we will talk about. So personal statement related questions will come up.